Welcome to the Besties with Breasties podcast. Sarah Hall here. I am a certified health and wellness coach, athletic trainer, mom, and breast cancer survivor. I help women overcome their own mind drama to make mind shifts that open up the possibility for their most empowered and energetic life.
And I am Beth Wilmus, author, speaker, and founder of a human investment organization, otherwise known as a nonprofit, called Faith Through Fire. Our mission is to reduce the fear and anxiety that breast cancer patients feel and replace it with hope and a path toward thriving.
This podcast is about our experiences with breast cancer
and life after as young survivors and moms.
So, Beth, today's episode, we're going to be talking about other women's experience, but we were kind of talking offline about how fun it was to reach out to women in our circles and get a bunch of unique experiences. So
I know, usually it's just you and I talking about what we did and why. And this was really the first time that we got to talk to other survivors in detail. I mean, we obviously deal with them all the time, but to find out what they chose and why they chose it. And I just learned so much,
Yeah, I think anytime you dig deep with somebody and ask them
what their motivations
what impacted a decision in their life, a big decision too. It's really cool to see all the different unique perspectives and what kind of stories come into everybody's decision. So yeah. I'm excited to share today.
Yeah, I agree. So I think we'll start with reiterating the recurrence rates for lumpectomy and mastectomy, which this is funny, but I think in my previous episode, I was saying reoccurrence. And I think it's recurrence, right?
Yes, you're right.
Yeah. Did you notice that when I was doing that last time? I kept saying...
I did not.
Okay. It's like you're mixed metaphors. You're always doing mixed metaphors. That's my thing. I'm always saying reoccur. I found it. I was like, I think I was saying reoccurrence, and I think it's recurrence.
All right, perfect.
All right, so I just want to put it out there.
The things that you learn when you listen to yourself.
Right, exactly. I'm like...
Good and the bad.
Right, exactly. So we'll start with the recurrence rates for lumpectomy versus mastectomy.
And then we will move into talking about some of the people in our circles and what they chose for surgery options and how that was different from us and what we chose, and really why they chose it. I think that's probably the most important aspect of getting other people's opinions.
Yeah, absolutely. And I think we'll wrap with just maybe some questions that you could ask your breast surgeon prior to making your own decision.
Before we get into that, let's hear from our first sponsor. For comprehensive women's health care, Barnes-Jewish St. Peter's and Progress West Hospital are your best choice for doctors, new technologies, and personalized care. With a broad range of women's health services, including breast health, continence and pelvic pain therapy, OBGYN care, and a birthing center, by choosing a BJC healthcare facility, you become part of a network that provides the world's best medicine. Schedule an appointment today by calling 636-928-WELL. That's 636-928-9355.
Okay, so we are back, and I want to reiterate the statistics that we kind of touched on in our last episode regarding recurrence rates with lumpectomy or mastectomy. So regardless of whether you choose to have a lumpectomy or mastectomy, the recurrence rate remains basically at 10% in the treated breasts and about 0.5% per year in the breast that has not been treated. So the risk of getting a different cancer is estimated to be about 2%. And this is all information from Johns Hopkins. This is all to just say that the recurrence rates are the same.
Which is actually, that's kind of a surprise. I was surprised by that anyway, just from the stories that we had heard.
Yeah. And I think the way that the caveat to that is that it's the same if you do a lumpectomy with radiation. So if you do a lumpectomy with radiation, then it's the same.
Gotcha.
So yeah, I thought that was an interesting thing too. And we talked about why, despite that fact, you and I opted to have a double mastectomy, but there's women that choose other options. And in fact, the more common option is lumpectomies. So
yeah, and I was surprised by that statistic just because of the circles, I guess, that I'm involved in and, I guess what I've seen on Facebook. I would have guessed that the more common option that women are choosing is a mastectomy, single or bilateral. So,
I mean, it's a pretty extreme option, like when you think about it.
Mm-hmm.
I mean,
yeah.
You know what I mean? And I think it speaks to, like you said, our social circles with younger survivors who opt to have that more often, but that's not the standard that most women choose. So I think let's start with some of the women we spoke to that chose lumpectomies, because that's what the majority of women still choose.
Right. So tell me about, you talked to Cindy who had a lumpectomy. What was her experience and why did she choose that?
I actually found Cindy's reasoning really interesting because she had originally wanted a double mastectomy because she had very large breasts and they caused her a lot of problems, which I could totally relate to because I was the same way prior to my mastectomy. If you have a large chest, there are issues that come with that. So she really didn't mind the idea. She said in part because she felt like she was 68 years old and she was okay with the idea of letting them go. But she changed her mind and got a lumpectomy because she said her surgeon pointed out that because she was a heavier woman, that she would have a lot of excess skin that would hang off the front of her chest. And that would then require additional plastic surgery, which she hadn't considered. So when she found that out, she went ahead and went with the lumpectomy. And she's very happy with her decision. And I asked her, and she said that she does not worry about recurrence. It really isn't something, that anxiety does not bother her at all.
That's interesting. I would be curious to understand from her perspective, why that isn't, what her follow-up looks like and where her mind is at to make sure that she has that fear that's reduced in her mind about the recurrence.
Yeah. Well, I think that just speaks to all of us having various,
levels of comfort.
Uh-huh.
Yeah.
Yeah. Really. And because I did speak to another woman, Karen, actually, and you and I spoke to her about her because she's 42. And she chose a lumpectomy because it was a quicker recovery and it would allow her to keep her breasts. And she doesn't have regrets either, but she actually does suffer a lot of anxiety when it comes time for her annual mammograms. Mm-hmm. But she feels like that anxiety is worth, keeping her natural breast.
Yeah.
And so while that does cause her a lot of anxiety, she plows forward. And
Well, and I think that's why you and I both chose what we chose, because we knew, I guess, preemptively that anxiety would be there. And so I would venture to guess that that's why probably a lot of women choose to go with the mastectomy.
I think it plays a part. Yeah. I mean, I really do.
So that's interesting, Karen's story. I want to share about my friend Amy. She's 44. She has 3 kids. She had originally opted for a lumpectomy because what she said, her husband is a boob man. But then shortly after, she got the news that her cancer had come back. So this time, she said it was like a no-brainer for her to choose a bilateral mastectomy. So she chose that because her cancer, like the chances of that coming back again for a third time was pretty high. So she's glad that she did, because they actually did find cancer in both breasts.
So when they did the pathology from the double mastectomy, they found cancer cells in the other breast?
Correct.
Okay.
Yep. For reconstruction, though, she did decide to, there wasn't really an option for her. She had heart surgery when she was younger. Mm-hmm. So her skin was really thin. So reconstruction wasn't an option. So she actually opted to stay at the end of all of that flat after.
Wow, that's interesting. She started with a lumpectomy, did a double mastectomy, and then ended up with no reconstruction at all.
Correct.
Wow, that is a journey.
It is quite, she's had quite a journey. She's very much a warrior.
So how does she feel about being flat? How does she feel about it? Like her, the whole process?
She feels confident in it, and she's actually even gone so far to have a tattoo over all of it, which is gorgeous. She's now a beautiful piece of art. So she's
cool.
really confident in it. Yeah.
That's awesome.
I have actually another person that I followed up with. She is a friend that I met through social media, through a mutual friend, and she lives in Oregon. Her name is Rachel, and she has a really, really cool story and a really interesting perspective that she shared with me about why she chose to go flat. She was larger chested before, and she's an endurance athlete. Mm-hmm. And so she knew she was already kind of, that was a point of frustration in her life. So then when she found out that reconstruction for even to make her chest smaller for even an A cup was going to include taking muscle from her back or multiple surgeries and unknown factors like how long it would take to heal, she just didn't want to go through with all of it.
Mm-hmm. I hear that a lot. Like some women are like, no more surgery.
Yeah. So she came to terms with the fact that, and this is a place where you kind of have to put your mind to it, that her breasts aren't what made her feminine, which is a really strong and empowering place to put your mind. And she couldn't imagine prolonging her treatment journey just to get breasts that weren't, in quotations, hers. Mm-hmm. So her plastic surgeon, this is really cool. Her plastic surgeon actually said, one of the most key statements to her that helped her make her decision. She said that breast reconstruction will make you look normal with clothes on, but when you're naked, but not when you're naked. So she said that was actually one of her most profound statements that helped her come to her decision, which is cool that it came from her plastic surgeon, I think.
Right. Yeah, she wanted to set her up with realistic expectations.
Yeah.
You know? Yeah. Which I think is cool.
Yeah. She said it was a tough reality, but it totally made sense to me. And she didn't want to go through the huge process to still not feel normal. So she chose to stay
And
flat.
how does she feel? Is she glad she did?
She's very empowering. Her social media, I highly recommend following her. She posts pictures. She's an avid hiker.
I have never met a woman who chose to go flat that regrets it. Have you?
No, absolutely not.
Usually they are just thrilled and excited that they did it. And again, like, I think that sometimes providers are surprised when women opt for double mastectomies when it's not necessary in their mind. I think they're equally interested when women choose to go flat with no reconstruction. I think it evokes that same curiosity. But every woman I know that's gone flat has been incredibly empowered by the experience and happy they did it, which I think is so interesting.
I follow a few people on social media, one of which I think her whole social media is around clothing options. Because if you think about like a woman's closet, like we've got dresses that have chest darts in them for our breasts, and what does a shirt look like when it's meant to be a V-neck? Like she posts a lot of pictures of her in clothing, which I think it's really cool to follow and to see her perspective on how she views things and how empowered she is by the clothing's choices that she makes.
Right.
Yeah.
Yeah, I agree. If I had opted to not do reconstruction, I think I'd own it. I'm not going to put I'm all about efficiency.
Yeah.
So I'm not going to put a lot of extra effort in trying to pretend something's there that's not. That's just me.
Yeah.
But I think that's really cool. I'm really fascinated and interested when women just own their choices and are fearless about it. I just admire it.
Yeah. And all that money you'd save on bras.
Oh my gosh. So true. Well, let's talk about Joan. Joan is she was 48 when she was diagnosed with breast cancer. She is now 20 years post her diagnosis. She had 2 kids at the time. She chose a single mastectomy with a tram flap reconstruction from her stomach, and that's when she was diagnosed in 2001. Are they doing tram flaps still?
It was presented to me as an option, or I think it was at least educated to me as that's an option that's out there.
Okay.
So, yeah, I do think that they are still doing that.
Okay, interesting. So she did this because there had been some recent reports of implants that were leaking and causing a lot of trouble and pain and disfigurement, and she didn't want to deal with any of that. And she wanted her implant to be natural, like her own tissue.
And I've heard that from a few women that I've mentored is that seems like an option that they would like because of the natural feel. And that's typically why I think people choose the DEEP or the tram.
Well, and not only the more natural feel, but also with implants, you have to replace them at some point, which guarantees more surgeries. So for people who would like to move on and not have to think about additional surgeries, that plays into a lot of people's decision making as well.
Right. Yeah.
Which I think is good to bring up if you don't want additional surgery. So how did Joan feel about her surgery?
So when she chose it, she thought that it would be a good choice because she had imagined them growing or shrinking with her depending on where she was weight-wise. And she had the option to do both breasts, but she decided to only do one just because she didn't feel like there was any risk. With the other side, with her good side, she says. But after about 6 weeks, she did end up going back in to have her surgery side reduced, which she ultimately found out it was bigger because of the swelling that she had been having.
The postoperative swelling lasts a really long time.
It does. I feel like it could take like a year for things to really settle. So she went
back in for a revision 6 weeks?
Oh, after 6 weeks, my tram flap seemed largely out of proportion.
Oh, that's early though, like in the process.
Yeah. Yeah. So I think now we'll have Joan on here probably in a few months.
She has an unbelievable story.
Very cool story.
She's another one where you're just like, what? You're amazing. So
we'll have her on to share about her whole journey and how she feels about her reconstruction now. as part of our Thriver series. But just painting a picture about why she chose what she chose at the time, I think it's really good point to bring home is that you just educate yourself and kind of make a decision on what feels right for you, just like all of these women did at the time with what you know.
Mm-hmm. Yeah, absolutely. You know what I think we should do?
What?
Boobs in the news.
Oh, yeah. Boobs in the news.
Well, let's do boobs in the news, and then we'll kind of like wrap up about anything that we were surprised by in our own surgeries, and then maybe questions that people might want to consider asking their surgeon. Does that sound good?
Yeah.
All right, let's do boobs in the news first, though.
Boobs in the news. This is a fun segment where we read funny tweets from real people or ridiculous news stories.
Boobs in the news. Boobs in the news. Boobs in the news.
All right, you ready for this? This is from our friends at the Daily Dumbass. And I love how they write this. It's back to Florida because a lot of these stories originate in Florida.
Poor Florida. They get such a bad rap.
They really do. Okay, so a 28-year-old guy called 911 to tell police to come take care of the aliens he was seen flying low to the ground.
Oh, no.
Yeah, James, his name was James. James said that if they didn't step up, he'd have to go Independence Day on their asses.
Oh, no. Was it like a drone?
No one saw the aliens except for James, but police did arrest him for misuse of 911. Here's what they think happened. They said James must have taken the brown acid. Don't be like James.
Don't be like James.
Should I know what brown acid is?
I have no idea.
Do you know?
Nope.
Okay, well, the cat's out of the bag. Sarah and I don't know what acid looks like or what color it should be, but apparently the Daily Dumbass thinks that the brown acid's the bad acid.
Okay.
That's funny. There's your boob in the news.
Boobs in the news. Boobs in the news. Boobs in the news.
So we are back. We wanted to kind of share some things that surprised us after surgery. I want to hear from you first, actually. When you woke up from surgery, what are some things maybe that were surprising to you that you hadn't expected going into surgery?
Well, I think back on this and I did not ask a lot of questions regarding the surgery. Like there were things I'm like, oh, I wonder why I didn't ask that, but I didn't. One of the things that surprised me when I woke up was just the level of numbness. My chest felt like it was like out 5 feet from my body. Did you feel that way?
Yes. Yeah. It felt like swollen and it felt, it didn't feel, actually. That's what I found so weird. Like in my armpits were even kind of numb and tingling, which from mentoring people, I have noticed that doesn't happen to everybody.
No, I didn't have that.
But it felt weird to put on deodorant like for a while. Yeah.
Do you put deodorant on your side that had surgery?
Yeah.
Oh, see, I had radiation, so I don't stink over there.
Oh, well, that's lovely.
I know.
That's a nice little side effect.
There's a nice little positive silver lining.
Yeah.
The numbness. Yeah, I didn't have it in my armpit, but it was, and I don't think that's unusual for a major surgery to have numbness at the site, but it is like a lot of numbness. And I remember thinking to myself, wow, I didn't know that the rest of my life was going to feel like this. Now, it does not.
No.
Like it does not.
Yeah.
The longer you go out from surgery, the more it feels more natural and you don't have that numbness now. And I actually have a lot of sensation in my chest now. So it just depends. But at the time, I was shocked at how numb it was.
It is really shocking to wake up and to not, even now, sometimes I'll boob graze somebody and be like, oh, I didn't know I did that. Or, you get a funny look from somebody like, oh, crap. Did not mean to do that. So, but no, the feeling comes back. It just is it's very difficult to explain.
But it's worth bringing up because for me, it didn't bother me and I didn't give it much thought other than, oh, that's interesting. I wasn't expecting that. But for some people, it's very traumatic. So we want to point that out because I've read stories where women feel sad because when they hug their grandchildren, they don't feel them the same way that they would have prior, or not all women get sensation back, and so there are some side effects that you maybe aren't anticipating, and then it can impact your quality of life, and nobody prepared you for it. So I don't want to make light of it because it wasn't an issue for me. Doesn't mean it wouldn't be an issue for somebody else, and it's definitely something to ask your surgeon about. I think
just to prepare you and see what they say for sure.
Is there anything that you found surprising from surgery?
I feel like that was probably the biggest one. And it's not even just from the mastectomy or from reconstruction, but even I had some liposuction for like filling in on my last swap surgery.
Yeah, are you glad you did that? I know lots of you are?
Yeah.
Okay.
So glad I did that.
Are you? Okay.
For my swap surgery, that was probably the most painful part of that surgery.
I've heard that's very
I
painful.
did not expect that at all. Like I felt like I got punched in the gut and it didn't go away for weeks after. Like it hurt to just sit up out of bed and I didn't expect that at all. I thought, oh, I'm going to wake up and be skinnier. And, you know, there were moments where I was like, well, that was not worth it.
The bloom is off the rose.
Yeah. Yes. Yeah.
Sounds good in theory, right?
It does.
Yeah. That's interesting. A lot of women do that. And they don't always necessarily do it at the time of their reconstruction. Sometimes they do it later. And so that's good for people to know, too, that sometimes they'll take fat from other parts of your body and put it in your chest where the tissue is really thin and give you more voluminous.
Yes.
Is that the right way to say that? Voluminous? That sounds wrong.
Yeah, I don't know how to say that. Well, my surgeon called it like giving you cleavage. Like it's the thing that like, you know, makes you look natural instead of just looking like you have a balloon under your skin. So
interesting.
Filling in. Yeah. Or he called it the icing, maybe. I don't know.
Icing? Yeah. Interesting.
But funny. I mean, I'm wondering what other, and we can share this, what other questions would be good to ask your plastic surgeon before you have surgery?
Well, you know, I'm kind of surprised that I didn't ask questions. And I always think now looking back, it's because I was traumatized and didn't know it. Mm-hmm. And so you're just trying to get in and out and try to, you know, maintain your sanity during this time. And so, you know, I look back and I think it's interesting to me that I didn't specifically ask certain questions, including, you know, how will radiation impact my reconstruction? Can I see pictures of your typical results? I didn't ask for pictures. Did you ask for pictures?
No, not at all. They took pictures of me.
Right.
But
Yeah, but you didn't ask for pictures. Now, if I had like cosmetic surgery, like if I was going to get a cosmetic surgeon to do something for me, I would be like, show me your befores and afters. And I once had a surgeon who was super transparent with me and I loved him for that. And he's like, listen, all surgeons show you their best work. You really need to ask them for their typical work so that you have realistic expectations of what it's going to look like. And I thought that was super instructive, but I didn't do it. So it's just something to think about, you know, asking a surgeon for their typical results. Where my scars were going to be, I didn't ask.
Yeah.
And I don't know. I don't know that I thought it would make a difference. So maybe that's why I didn't ask, because it's like, well, who cares? I have to do it.
Yeah. But, you know, I've heard of women, though, waking up and being like, oh, I didn't expect this. Like you get into your... you get in your mind a picture of what you're going to wake up to. And when it's totally different, sometimes, you know, for some people, it's not a big deal. Like for you, it wasn't a big deal to wake up and not be able to feel your chest. But for me, it did take me a minute to be like, wait a second, like this isn't what I signed up for. Will this ever come back? And had to work through that. But, you know, it depends on your own comfort level and what you're okay with. So asking the questions, it can be very important.
And I think, like, to your point, because you had some additional work done with the liposuction and giving you some extra tissue, you know, how many revisions does a woman typically ask for after her initial surgery? What types of additional surgeries might be in the pipeline in the future? You know, what are some common complications from surgery? Because there are a fair number of complications, not always serious.
Yeah.
But when you're doing a surgery like this, there are going to be complications a lot of times. And so if you're not prepared for that and then it happens, it can be very emotional. They're not going to necessarily lead with that story, though, right? Like, you don't want your doctor to be like, here's everything that could go wrong. So just, you know.
I think if they're not presenting it to you, you know, when they're telling you about the care plan, the big picture care plan, it's definitely questions that you want to bring up and ask. You know, I know my plastic surgeon did go over a lot of these with me, but you never know what their day is like. And if they leave something out, you want to make sure that you're well equipped to, you know, ask the questions when you're in there, clear-headed, not coming from a place of like, I just need to get this done.
Well, and in regards to like them not leading with the bad news, I think that it's so important that they do communicate the potential complications, but then you can be positive about it. Here is a common complication that a lot of women find after this reconstruction. However, it's easily fixed, and here's how we do it.
Yeah.
You know, you can follow it up with, if this were to happen, we see this all the time. We know how to fix it. Here's how.
Right.
I think that does a lot in building credibility and helping prepare a woman for what to expect so that they're not disappointed or scared.
Yeah.
So I think it's really, it always goes back to that communication piece. And because you're traumatized, you know, it's just helpful to know maybe some of these things from the perspective of people who have been there, done that.
Yeah.
So
yeah.
I don't know how you feel about that, but
I agree. I agree. Communication with your provider is incredibly important. Before we recap today's episode, we're going to go into our second sponsor.
Hair loss is consistently ranked as one of the most feared side effects of chemotherapy treatment. The emotional impact chemo hair loss can have on patients has been well documented. Scalp cooling is a simple treatment that can prevent hair loss caused by certain chemotherapy drugs. The use of scalp cooling is proven to be effective in preventing chemotherapy-induced alopecia and can result in people retaining much of their hair. Paxman is the global leader in scalp cooling. Their cold cap is scientifically proven to reduce hair loss during chemotherapy. If you are facing cancer treatment and concerned about losing your hair, ask your provider about scalp cooling and visit our website at paxmanscalpcooling.com. That's paxmanscalpcooling.com. Okay, and we're back. So in terms of a recap or advice we have for women, what are you thinking from this episode, Sarah?
From all of the perspectives that we shared today, with all the women who chose a lot of different options and routes, you have to consider what is best for your family, what's best for you, what will give you the most quality of life, and consider all the aspects of your life so that you will come out with, likely as little regrets as possible.
Yeah. And again, going back to the statistics, the good part of that is that you have a wide array of options, because you don't have to, according to the data, worry that one option is quote unquote better than another, right? Mm-hmm. So the statistics favor a wide array of options and you can choose the one that's definitely best for you. And I think it's important to note that out of all the women that we've spoken to about their choices, very few have any regrets.
Mm-hmm.
So I think that should give you confidence in making the right choice for yourself and then moving on.
Yeah. Yeah.
So next time on the podcast, we're going to talk about why you should talk to your doctor about the risk of lymphedema before breast surgery.
And Beth is going to share her experience and why it is so important.
Until next time, guys.
See ya.